The Washington Post has reported that the CDC, the Centers for Disease Control, received a list of words that are forbidden in some of their published work. Now, there is some disagreement about whether or not these words will be used in the future. However, what we do know so far is that policy analysts at the Centers for Disease Control and Prevention in Atlanta were told of the list of forbidden terms at a meeting with senior CDC officials who oversee the budget. And that's according to an analyst who took part in the 90-minute briefing. So that analyst went on to speak to the Washington Post. The Washington Post seems to have corroborated what that analyst has said to them. And here are the forbidden words that were included in that list. Vulnerable was on it. So was entitlement, diversity, transgender, fetus, evidence-based, science-based.
So let's pause here for a couple of things. We're gonna rank those words in a second, which is gonna be fun. But this is literal political correctness. So people wonder where political correctness came from. It actually came from, I did the research on this, both the Nazis and Stalinists. They both used some version of that. The Nazis used it first, but Stalin also used a slightly different phrasing on it. And what it meant was, we don't care what the truth is. We're going to tell you not what is scientifically correct or technically or legally correct. We're going to tell you what is politically correct. So here are the words you can use, the words you can't use, whether they're about the Jews in regards to Germany or about the workers and the capitalists, et cetera, when it came to Stalin. So now the Republicans, who claimed my whole life that they were against political correctness, literally using political correctness here to tell you what you can and can't say. And it's not whether you're offended, it's not suggestions, it's not etiquette. It's no, if you work for the government, you are not allowed to use these words.
Right, so let me clarify something, because the way I presented the story might be a little misleading. I wanna make sure everyone understands what the intention is behind this. Now remember, this is during a meeting with CDC officials who oversee the budget. The CDC is a federally funded government organization. And so they decide what they do with that funding, what kind of research they do. So think about it. They're forbidden from using words like transgender. What does that mean? It means that they're no longer allowed to allocate federal funding, or at least the intention is to prevent them from utilizing federal funding toward research for the transgender community. And to further reinforce that point, think about the fact that the government has essentially taken down any and all web pages relating to the LGBT community, web pages that were meant to give them advice, give them help when it comes to a number of things. Those were promptly taken down after the Trump administration came into office. So it's really about where the money is gonna go, and it shows you what the priorities are for the Trump administration.
So I'm trying to figure out, of those words, which are the most absurd. So I know why they put transgender, fetus, entitlement, et cetera on there. But one, you're telling the Centers for Disease Control and Prevention, pretty important that we get that right, don't use words like science-based and evidence-based.
Right.
Jesus Christ, what does that mean?
It's crazy.
That's insanity. So if we have a Zika virus breakout, or God forbid, Ebola or something worse, we're not allowed to do evidence-based research? We're not allowed to say the words science-based?
Why can't you say it? Why can't you call it by its name?
Just say it.
Why can't, or what are you afraid of?
Okay. But to me, the most weird is, I guess, diversity. Why are you not allowed to say diversity? Are you not allowed to have diversity in anything? How about diversity in plant life? We're not allowed to talk about that?
No,
And
diversity is terrible.
The word vulnerable is outlawed, not for you and I, but seriously for these government workers and the people who do the research. You're not allowed to use the word vulnerable, because God forbid you would want to protect people who are vulnerable.
So let me give you some of the suggestions that the Trump administration gave to these CDC officials if they're looking for substitutions for these words, okay? Now in some cases they provided no possible substitutions at all, but in other cases they did. In some instances the analysts were given alternative phrases. Instead of science-based or evidence-based, the suggested phrase is CDC bases its recommendations on science in consideration with community standards and wishes. Yeah, I don't give a about community standards and wishes. I care about the scientific evidence backing up what the CDC is gonna do.
And if you're wondering why they're saying that and phrasing it that way, here's why. They don't actually mean community standards. Like the community would not like to get Ebola.
They mean right-wing. They mean right-wing public opinion. That's what they mean by that.
Partly. The other part of it is the companies. So if the company says their standards don't want that drug to be regulated, for example, right? Then all of a sudden you can't regulate that drug because it's, what did they say? Recommendations, not science, but recommendations on science in consideration with community standards and wishes. In other words, in consideration of right-wing talking points and the wishes of our corporate donors.
This is crazy. It's crazy. I mean, we knew that it was gonna be bad when he got elected, right? But it's actually much worse. It's worse than my wildest dreams. It's insane. I mean, from net neutrality being dismantled to them banning scientific words, or it just keeps getting worse. It keeps getting worse.
The Department of Health and Human Services spokesperson Matt Lloyd told the Washington Post, because CDC is under HHS, no. I mean, you're not allowed to say evidence-based. He doesn't get into that, but he says this quote: HHS also strongly encourages the use of outcome and evidence data in program evaluations and budget decisions. In other words, I'll use evidence and data about finances, like, hey, this hurt a company's bottom line. You put in a regulation and it cost them money to make sure you didn't die by taking the wrong drug, right? Well, so, I mean, and look, there's a lot, CDC touches a lot of things, or that you didn't get sick, right? And this also goes to eventually the Food and Drug Administration, et cetera, in terms of this ideology, right? But so I can show you evidence about corporate numbers, but you can't show me evidence based on science. God help us all, because apparently that's all that's left, because this is how they eliminate science from our lives, which couldn't be more dangerous. You just watched the video by the Young Turks, home of the revolution. If you'd like to get a lot more than that, get the full show by becoming a member. tytnetwork.com/join.